Hello, everyone, and welcome to this fantastic webinar. We are delighted to be here to talk to you about GDPR, namely General Data Protection Regulation, specifically for health technology companies. However, this session might be useful for anyone dealing with personal data and willing to understand GDPR as well. Today's session will start with an introduction to GDPR in health technology company, and then we will talk about data protection challenges that health technology professionals are facing. We'll also give some real-life examples of GDPR violations. And finally, we will answer some questions commonly asked. Before we jump into our topic, I would like to introduce my team. Hello, Olga. Olga is our privacy expert, and she is also CEO of CyberWise Space Company. And Ali is here. He is a cybersecurity expert, and he is CEO of a CyberWise Space Company. And I am Berna, and I'm a healthcare expert and digital health student. Now we will talk about a bit GDPR. First, I would like to ask a question to Olga. So, what exactly is GDPR and why it has such importance for health tech companies?
Okay, thank you, Berna. I think that maybe before we jump through to GDPR topic, maybe we will also add a few words about us. So I'm Olga, as Berna introduced me. I'm privacy expert, and I have background in law, and Ali and I co-founded CyberWise Space as a company to focus on privacy and cybersecurity to help startups to help with GDPR compliance and to help with technical problems like cybersecurity risks to help manage this. So as a lawyer by training, I understand how much challenging for people would be to understand these complex things as GDPR. I switched more to technology field when I came to Estonia, which was around six years ago, and I made my focus on healthcare field, and it was much different compared to what I was familiar with. And here in CyberWise Space, we are actually trying to make this connection. So maybe Ali can add a few words about him and
Yeah,
about.
thank you. Hello, everyone. I'm Ali. As both of my colleague mentioned, I'm working in cybersecurity for 8 years. I've been in different countries working in this area. We established the CyberWise space a couple of years ago, and we are mainly I'm mainly focusing on cybersecurity, system administration, and basically make sure that you're not gonna be hacked.
Yeah,
So, yeah,
that's important.
yeah.
That's like the most important outcome, basically. And answering your question, Vern, about GDPR, yes, that GDPR is very important regulation which came into force a bit more than 5 years ago. And at this moment, actually, companies and people in general start understanding that it's not just something that exists on paper, it's actually something that is related to all of us as people, because GDPR is about personal data. And we run this series about healthcare data. So if we are talking about GDPR that is related to healthcare, it's even more valid and even more important, because if we have our personal data, that is already valuable. But if we have healthcare data, like information about our treatment, information about healthcare, about prescriptions, about our health in general, there is even bigger value of this data, let's say, like in a black market, and also for so it's basically for good companies and for the bad companies. So it can be used as a good thing, but also, as I mentioned, it can be it can go against the person. But what is different about GDPR compared to other fields? It's exactly the value of healthcare data, is that it's dealing with sensitive data, and that is like one of the biggest points. And if we have personal data, sensitive data, it needs to be better documented. So if company is running with personal data, they need to have more documents compared to like a general company, and they will also need more cybersecurity measures to make sure that this data is properly handled. I think that maybe Ali can add a few words about cybersecurity.
Yeah, there are many aspects need to be considered in the cybersecurity secured in domain of GDPR. But mainly speaking is about IT perspective. So how to make sure that your data are safely stored and your data are safely transmitted. So these are the two key aspects of this domain. But there are other areas that are treading the GDPR to be compliance with GDPR. It can be a human chains, it can be ransomwares, and as I previously mentioned, the IT side of the attacks.
Okay, thank you for your answers. So, from their explanation, we can see that healthcare technology dealing with big data, which is very important. So this needs some really important measurements, like including privacy and security, like my team members said. So I would like to ask one question for Ali. We talked about sensitive data, which is very hard to deal with. So this sensitive data brings some problems, challenges. So can you open more about the difficulties that health tech professionals are facing? And as a cybersecurity expert, what is your approach to these challenges and difficulties?
I usually divide my challenges into two sections. One of them is a human side because it's our weakest chain. And I'm mainly starting with phishing emails and get fished by emails. After the COVID, the phishing email for healthcare become more sophisticated and personalized, like it coming from WHO, NHS, or your health organization, because now people start trusting this or knowing this organization. So the attackers make a more personalized emails. And also, if you are working in a company, now it's becoming harder and harder to trust the email that you are receiving. Sometimes you have to double check, is it from the authenticated user or not? So how people cope with this in a recent year is trusting the message that you get on your phone from a Slack, WhatsApp, or other platform. They think that this is more safer than email. So now we are dealing with starting a catastrophic problem that we don't know. Either we should secure the WhatsApp or we should secure the emails. Another subject is about awareness that me and Olga were working on previously, because most of the people that are in this domain are not experts. They are doctor, nurses, accountant, normal people. That they don't have a much cybersecurity knowledge. So one of the most important is to have a cybersecurity hygiene. So don't plug random USB. Just this is my X-ray. Can you, doctor, please plug? No. Or this is my dental photo to the doctor. Can you please open this email? No. These are like basic, but no one using it.
That's a good point, because as a nurse, I have no idea about these things before I was in this team. So most of the people in healthcare, they really know, like they have no idea about cybersecurity. So it is really important to educate employees about cybersecurity and privacy. And thank you for your answer. And of course, these not becoming aware of cybersecurity and privacy result in some problems. So there are some cases, real life examples of GDPR violence that result in some serious consequences such as fines. So Olga, can you give some example for us about GDPR violations in real life?
Yeah, sure. I think that we can actually focus a little bit even broader about healthcare companies, and specifically like also for example, we can give example of health tech startup that provided a mobile application, and they collect different personal data and specifically healthcare data within their applications. So the idea of the application is to connect doctors and patients, and doctors can provide some consultations based on information that was provided by users. So, but there is like a lot of health data that is shared. So there might be like prescription, there might be some diagnosis, or in general information about procedures and treatments that was done for this for those people. And what was the question? Like one of the question was that doctors will have the same access to this information that is provided by users, same as technical specialists, same as admins. And the question is if this is correct. And well, we would say that yes, it's not correct. It should not be. It is a violation because it's not privacy by design. It's not privacy by default. We understand that GDPR has a requirement that people receive only this information that they need to actually provide the services within the company. And there, of course, we can see that sometimes admin can have this need to access the system when it's broken or something, but what we need to do, this should not be like a default, and they should not have this access only because something can happen. We need to understand very specifically where is the measure. So what information is needed to be provided to the doctor, what information needs to be provided to the admin. And it's a very cybersecurity related question that it should be properly tracked. So if someone has access to the data, we need to know how it's done. So I think Ali can elaborate on that.
Yeah, very good point. In a real life, I mean, on a utopia, when we're talking about, yes, everyone has their own right, access, and segregation of duty is perfectly implemented. But I don't know any good example that is very properly implemented. It's either health tech startups, clinic, or we go bigger hospitals, ministry, and those other related. So one of the good things that Olga mentioned is just being accountable for your action. So everything should be logged and monitored by either IT department or auditor or higher level. Because if the IT department cannot verify their own action, so there needs to be another party involved, like as an auditor, to verify that if they are doing good. And usually IT department has access to anything, so they should be very, there should be enough reason why they look to the personal data. So I highly suggest proper logging and monitoring for each section. And of course, it would be good that each department has their own set of access, but I understand it takes a lot of time and effort for a system that is already working to be implemented new set of rules. So it's very challenging for companies.
Yeah, these are very important and good points.
Just to add about that, those are not just rules that exist, but actually we can bring up an example when hospital, like big hospital, received also a big fine. It was one of the biggest and one of the first fines by GDPR. It was the case of Portuguese hospital. Actually, they received like 3 fines, and in total, the amount was 400,000 euro, which was pretty big amount. So what happened in this hospital? First of all, they had more than 900 accounts. They were marked as a doctor, but only around 300 doctors were actually working in this hospital. So there was a question, who are all those people? So seems like
Worker, any
well,
worker working
any
there.
workers or any workers during those years. So, and actually, during the investigation, they found out that some accounts were deleted only like 3 years before. So actually, that they did not do cleanup. So most likely that those are some doctors that were working at some point. That was one of the problem. Another problem is that technical employees, there were 9 technical employees in this hospital, they had the same access as doctors. And basically they could have looked at any healthcare data and well, without actually any kind of monitoring. So even if they will look, no one will know about that. So
From
that
the
was
outside, it looks very simple, but when we think about other like patients' information, they have their health data, like such as their, so they might have some like disease or something that might cause them to be discriminated. So it's very actually something very important case. It's very
yes, it's definitely healthcare data is your most sensitive data and needs to be protected properly. So it needs to be protected all like from your side and also from the company side or healthcare institution side. So there are like 2 sides of it. And also talking about this fine. So yes, we have a very clear violation of minimization principle because well, different people just get access for no reason, and they did not prevent proper protection from unlawful access and no proper security measures. So I think maybe Ali can recommend what this hospital could have do to make it work properly.
Yeah, well, this hospital cannot be fixed. It looks like they were running on a chaotic situation.
Yeah.
But one of the best things that they could do was quarterly or annually access review. This is one of the well needed in each section. We highly recommend for every company to have a quarterly procedure, access review, install software, and basically understand in certain period of time that what's going on in your system. Is it a random doctor and worker, or they left, they have access, and what type of access they have, and this need to be approved by management and CTO or whoever is in charge in terms of IT. I think if they had this procedure, they wouldn't have ended up in this getting biggest fine in a hospital
Yes.
history. So yes, I think some organization procedure were missing.
Yeah, that's definitely a good point, and I would say that cybersecurity, same as privacy, is a process, not a statement. So it's not something that you done and it's all good. Well, it's changing all the time.
Absolutely agree. Like it's a live process. You need to keep updating and patching stuff. Like let's say in any clinic, you find bunch of ER machines, and those are connected to your network that your doctor can monitor anything. So these machines are connected to internet. So you need to always ensure that all these devices are working, patch. It's not only your laptop, your workstation, like anything you connect. We had a nice chat with one of these our medical devices expert, and she mentioned that about this subject. This is very well needed. That usually is missing, and it can be a case for digital startup as well. You know, they release something to the market, but they forget about, like, okay, we need to take care of this thing. Like, there was this Java Java vulnerability a few years ago, if you remember.
Yeah.
That was like
That was
affected
big. That was
affected
big.
literally
Yeah.
anything in this planet, and even the spacecraft in a Mars.
Oh.
It was running on, but there is no attacker on a Mars,
Extraterrestrial
so
attack.
they were safe on a
Yeah.
Mars. But you know, these things can ended up, you know.
Since we don't live in space, another place, so we need to take care of our security.
Yes, luckily there was no astronaut acting as a hacker. I hope not. But yeah, it exists everywhere. And as Olga mentioned, it's a live process. It's not a one time, one night, you know, anything. It's just you need to work on it every day.
Thanks. Thank you for your answers. Before finishing our sessions, we have a couple of questions from people.
We also have another case we would like to discuss. Yeah, with sharing data to third countries. I think that would be also.
Are you
Yeah. So if let's assume there is another healthcare startup, and they have a need to share their data with employees or with contractors, with consultant who is from another country, or let's say another country, and there are many questions about that, how they should proceed it, how to make it properly, how to make it securely. And we would advise that it depends on which country they are located. So basically, if this sharing is within EU, that would not cause much problems. They still need to have proper documentation for data sharing. They need to, if they're sharing personal data, they also need to have consent from the users, because their personal data is shared. Or if they are sharing some anonymized data, there is also the procedure of proper anonymization. That's first. And also should be consent from users for secondary data usage. So if the data is not anonymized and it's like shared for some other purposes than it was collected. But there is a question, so if it's shared outside EU, so what do we do? And there is also the question in which country you're sharing, and if that's a like trusted country with proper security measures, that should not be cases, should not be a problem case as well. Again, we need to have proper documentation, we need to have proper security measures for data transfer. But what if it's in some countries that are like outside adequate legal protection, and we cannot guarantee that proper measures would be applied there? So our suggestions, like for startup, if you can avoid that, well, you should not make your life more complex that it can be. It can cause much more problems for you than you will get value. And how we can confirm that is basically if we do a risk assessment. So if we do a risk assessment, we will do a calculation on how much data you will, how much money you will save compared to like if you share this data and you have your employees in some other countries. Well, let's assume it's cheaper to work in this country, but you need to apply proper security measures, and you need to have all those contracts, and it will also cost you money. So if you have certain risks, and if you calculate all the security measures to cover those risks, the value would actually increase a lot. And what you will save compared to if you will just process like in your country, that's like, I mean, you will not save any money. Because, well, that's like usually for startups the questions that they want to save money. So what we would suggest that don't make your life complicated, but try to make it easier, not vice versa. But if actually it's still necessary, and if you understand that it's still possible, but there needs to be proper investigation on on your partners, and you need to ensure that other party is actually capable to apply those measures, and both privacy and security. And you need to understand that your customers that, well, trust data for you, that you're responsible for that. So it's really important to apply the maximum measures to actually have this data protection. But yes, like if you're talking about if it's actually necessary to do that, well, proper documentation, proper security measures, anonymize when possible. So I would say that if you still need someone to process your data, it would be much better, and the risk would be much lower if you share anonymous data if that's possible, or pseudonymous if it's well, if anonymization is like out of scope. Maybe I can.
Pretty,
Yeah.
yes, complicated procedure nowadays. Like let's say India. It's a perfect place that most of the company outsource their workforce, especially UK-based company and American, because it's English speaking and it's much more easier for them. So you need to think about a lot of things before getting a customer data out of the EU or your jurisdiction. From the IT side, there is also even the cases, people renting the servers to run their systems. You go to the Google Cloud and you want to rent a server. So let's say in a Helsinki center costs €1 per day, let's say. But in a India, Bangalore server costs 50 cents. But now you expose your data physically to the new jurisdiction. So you need to make sure that the GDPR or if your data are gonna be secure, because you're not physically there. Someone
Absolutely.
go plug something or copy your hard drive and go and steal your data. Like it's a massive risk assessment you need to do. Like, do you want to accept the risk, or you just, as Olga mentioned, like let's not touch it. Let's do by book and avoid the risk here.
Actually, yes, this risk assessment is something that companies often neglect, and this is also one of the questions that we want to address in our project of GDPR Prodigy. And GDPR Prodigy is actually aiming to map the personal data that is collected by the company, and understand what kind of risks are related to the data that is collected, and also to look on what privacy and what security measures we can apply to protect this data. So we will in our social media post more about this project, but it's well, it's a pretty new and well, very exciting for us, and we really hope that for our listeners and for our viewers it also bring very big value. And we just wanted to share this information with you. But yes, follow us for more information. We will definitely share more about this project and about this development. So we have questions, yeah?
Yes, yes, we had some questions from our followers. First question is, it is actually for Ali. I think he can answer this question. What small companies should do to become compliant with GDPR?
I can answer from IT perspective from my side. Yeah, you want to say something?
I don't
Oh,
know.
no.
Sorry.
No, no. Usually small companies, the way they store and transmit their personal data is a key aspect for them. So, to my understanding, they either go for a popular cloud, Google Cloud, Microsoft, whatever it exists on the internet. So just to make sure that your data is encrypted, just don't upload anything there, you know. It's cloud, okay, it's safe, but anyone with the username password of you can log in and steal everything. Make sure you have a copy of it somewhere offline, encrypted. Or if you want, if you are doing your business on your laptop, again, make sure your laptop hard disk is encrypted. If someone steals it, doesn't have anything of your hand. Again, the most important thing is that even if you are a small team, two, three, four people, define level of access for you. It's easier now than later. Like you have your own role. I know it's a bit complicated, but still you can have some level of access to anything. So implement some basic cybersecurity, but I think maybe from legal side there
Yeah,
should be.
Olga might be add something. This is cybersecurity aspect, and maybe Olga wants to add something as a privacy expert.
Yes, sure, definitely. I would say that starting point and having a small company and small team is a good place to start, both for privacy and for cybersecurity, because it's much more easier to manage three, five people than when you have a huge corporation and and like hundreds of people. And from privacy perspective, I would say that you have two ways to deal with that. Either you learn and understand it by yourself, or you find someone who will basically do it for you, like advise you how to do that. You can go and search like literature, watch webinars, basically like this was introduction, and to understand like specific requirements. Or you can, and we actually think that that would be like a little bit better way and more efficient way of using your time, that you are focusing on your business, and you let people who are in this field in privacy and security help you. Of course, you will still need to do some work because it's not something that you can outsource and just forget about that. But as a privacy and security consultation company, we actually can help startups to like to navigate through the navigate through the problem. We can help establish both documentation and answer technical questions. And what we believe is really important to make this link between privacy and security, because you can have perfectly written privacy policy with super awesome legal language, but if in reality you don't have those measures implemented, I think it just worth nothing. And both are very important, but if I would say that really focus on real things and make sure that you're protecting your customers' data same way as you would like someone else would protect your data.
Yeah, that's a good point. Thank you for your answer. Before answering the second question, we have another question from our viewer. Maybe you want to answer?
Yeah, sure. Maybe you can read. Maybe you can
Okay.
read the question. Yes.
It says, what documents do you recommend for an e-commerce manager to learn about GDPR cases, main tricks, and rules to be aware of?
Okay, so I would say that if we are talking about e-commerce, it's a little bit different field. So besides general data protection, you will also need to learn about this financial cases somehow. It's not specifically our field of work, but if I could recommend something, I would say to look to the similar companies and that they are like a little bit ahead of you, and learn best practices in this field. Um, about GDPR, I would say that some webinars basically like this, or you can just search for some other free available materials, and this is something that should be helpful to understand the basic concepts. If you're dealing with a big amount of money, big amount of work, I would definitely suggest to find person. It's basically someone who will help you to navigate through that. There's
Yeah, e-commerce in pharma.
okay.
I'm thinking like, okay, let's say you have a online pharmacy, so it can be e-commerce in pharma.
Okay.
What things you can have? Well, there are IT perspective and there is a legal perspective. That so from the legal, what I can think of is just privacy policy, cookie policy, and of course sensitive data, because you somehow fetch the user's prescription from the national registry, or how this is.
Well, there is a question if it's in Estonia or not. Was it in Estonia?
Yeah, I don't know. There is
Because well, the thing is that we are also always assuming that things work like digitally, like in Estonia, but they can work differently.
It can be different.
Well, I would say that I would first Estonia.
She's
Europe.
Europe. Okay. Well, I would suggest to contact us after webinar so we can discuss it a bit more specifically. But yes, if the question is in general, so the question was about the documents. Let me just
tip and tricks for pharma.
What document? Or cases. Okay, tips and tricks. Well, yes, I'm still thinking that you need to look on how other companies are dealing in this field. So if you're talking about basic package that you need to have, yes, it's what Ali mentioned, that you need to have privacy policy, you need to have cookie policy, you need to have some document like terms of use. Well, not specifically from GDPR, but in general, you need to have it. Well, what else? You need to have internal documents that will actually guide your employees how to deal with data, how to what to do. So it's I would suggest to divide them to like external documents is something that you will display to your customers and users, and internal documents of something that you are using for like for yourself and for
Your team or employees.
for your team, for employees, because those are the people who need to know about the stuff.
I can add from IT perspective that it's very nice to have the information security policy in place. Basically, it's piece of document that's saying that who has access to what type of access are granted, if you need to share the process, how this how if you need to share the data, how is this process, and then where and how this data is stored. Another good piece of document is a backup and incident recovery. So let's say that there is always a chance that there is something go wrong, so you know what to do. There is exactly in place that I will click on this, I will click on this, I will shut down the website, I will call this. So you need to have the backup and incident recovery in place. And if you want to go a bit further, it's very nice to have a change management, because if you're gonna be licensed, operating in the licensing market, I assume pharma e-commerce is heavily licensed market. So you need to deal with the auditor that's gonna ask you a million of questions, and one of the document is a change management document, that how your changes are in place. So if you change this button, what was the reason? What was who approved this change? So these are top 3 documents I can suggest from the IT perspective.
Just to add about GDPR. So GDPR exists as a document, as a regulation. You can take a look at different websites, but besides that document, there are different working parties that are separate documents that kind of explain GDPR. So, for instance, if there is a question regarding data processing or like specifically sensitive data, like how to access this, and there are special documents. And you can look on those working parties that are related to your field. But I will just warn you that those are legal documents, so it's not always easy to understand them. Um, so, well, as a lawyer, I'm just like reading initial source, but if you would like to receive this if you would like to receive those like easier answers, I think this is something that needs to be Googled. Or if you have specific questions, we also would like to hear those specific questions, because we want to address problems that companies is having. So maybe this is something that we can discuss in our further posts, or something that we can discuss in our further webinars. So we highly encourage the author of the question to contact us, and we can discuss. Maybe we can help with these questions, or you can provide also the materials so we
Please
can help
don't
others.
ask from ChatGPT.
Uh,
Don't trust it.
Okay, that's
Another
that's totally other topic. I think we also need to discuss at some point
Yes.
AI in general, but I mean, now that's not trustworthy source. They can give some good ideas, but this is always something that you need to double check and triple check, because I
Yes.
mean
Yes.
that's
It's
not
so random.
that's
Yeah.
that absolutely, yeah.
Do we have more questions?
Yes, last
Good.
last but not least, it's very important questions for me. It's about data breach.
Okay.
What should we do if we are faced with a data breach? What they should do in case of data breach?
Um, yep. Well, you need to take a deep breath and
Try cold
smile.
water.
Yes, you can shut down everything and go home. No, from the IT perspective, well, the most important thing is just to inform the data subject, I guess, in a correct term, Olga. Data subject.
Data subject,
It
yes.
depends, actually.
Yes, you need to inform people. Yes, there
If
are
there's serious.
there are exceptions, but you need to, well, first of all, you need to investigate and understand the scope of it. And if you required by GDPR to like to inform data subjects, so basically people who whose interests, whose rights were violated, you need to inform them. If you need to inform authority, it's also like you need to inform authority. And GDPR also has time limit for that. So you need to understand, first you need to understand the scope of the problem. Like,
What happened?
yeah, what
basically?
happens? So,
Yeah.
so is it like data breach? Is it only like a small data breach, whole data breach? Because if you store it in a different, like different servers, or like if your laptop was hacked, was it like all information about all your company? There's some.
Is it affecting the data
Yeah.
subject
It's good that you
intensely?
write the process in your incident response because it's an incident. You have a
Yes.
data breach. So as Olga mentioned, yeah, we're starting to understand the scope, what's going on, then informing the interest, and then we do the root case analysis. That what we didn't have in place that caused it. Was it the 0-day attack that no one doesn't know about it, or it was our fault that we forget about something? And basically fix and continue. But there are other type of damage that you need to deal with it, such as a business reputation and the other things. So they are like a financial time and hard time for your company. So yep. So yeah, maybe you ended up in a tech news that this company had a data breach. So I hope not.
Not the best way to end up in news,
Yes.
definitely.
Data breach is something any company should not face, I think, since like
Hope.
so many bad consequences they might face. And also being GDPR compliant and keeping up with regulations, like because laws in GDPR can change. So we need to
Yes.
keep up with these changing regulations. So these are not easy things for companies, especially companies dealing with health data. So for us, we can advise to get some help. You can contact us if you have any questions. We are active on LinkedIn. We are every week we are sharing article about GDPR. You can visit our LinkedIn page, which is GDPR Prodigy. We will put the link on description. You can check it out. And there will be more webinars about GDPR and more. There will be more topics. So we would advise you to stay tuned, and you can follow our YouTube channel. And thanks for watching us.
Can I add something before we
Of course.
close? Before this meeting, I saw from U.S. Department of Health and Human Services, HHS, some statistic that it's a good news now. Actually, the number of breaches happened in 2023 is less than 2022 and 2021.
How come?
So we are getting more secured in a healthcare somehow.
Okay.
I think because of COVID, like everything like overwhelmed, now people start understanding. So it's not very dangerous. Things are getting better. So just wanted to lighten up before we end the meeting.
Okay, that's very good, but let me give some skepticism here. So is it because like the real amount becomes less, or because it was reported less? So
That's also, these are reported data, so
Reported
we
data.
cannot
We
don't
cannot tell.
verify
not
that
sure.
how many cases happen. So yeah.
But yes, well, I really hope that it's actually because there are less attacks. Although I don't think that the amount of attacks is actually decreasing. It's like the amount of attacks is definitely increasing.
Yes.
Yeah, but well, if healthcare institutions has better protection against them, that's definitely, well, that's a good way if the amount is lower. Yeah, that's a good news. Really
Good
hope,
news.
hope that it's how it actually is.
We are ending in a good ways, because before I talked about data breach and bad consequences, and you suddenly
No, the
it
world
was
is
good
getting
point.
better and better.
Yeah, still there's still hope.
There's
Okay, so thank you
Thank you.
for attention, and we are really looking forward to your questions or suggestions for the following webinars, or if you have something to discuss with us, feel free to contact. Thank you.
See
Thank
you.
you.
Goodbye.
Bye bye.